Good morning. I'm Emily Holubowich. I'm Executive Director of the Coalition for Health Funding. Welcome to my first ever vlog. I'll be vlogging more often, and you can find us on Twitter at Health Funding, on our website, publichealthfunding.org, and on Instagram at Coalition for Health Funding. Wanted to take the opportunity and really dive in with my first vlog in response to Politico's piece by Dan Diamond about the ongoing family separation crisis at the border and how exactly the Department of Health and Human Services is planning to pay for it and how much it will cost. This is the million-dollar question, or maybe we don't know how many millions of dollars. We know, here's what we do know. We know that when the omnibus was enacted in March of 2018, it did not include funding in anticipation of the administration's failed zero-tolerance policy of separating families at the border. That's pretty much what we do know. We do know that it's costing money. But there are a lot of things that remain unanswered. First, we don't know exactly how much it is going to cost, has already cost. We've seen reports coming out by diligent reporters like Dan Diamond about certain aspects of kind of historically what we know about what things cost and trying to spec that out to anticipate the ongoing costs of the current crisis. But that's about all we know. It's interesting, I take a little comfort in knowing that apparently members of Congress don't know a lot about the situation either. Rosa DeLauro of Connecticut, the ranking member on the House Labor, Health and Human Services, Education, Appropriations Subcommittee, sent a letter to Secretary Azar at the Department of Health and Human Services and Director Mick Mulvaney of the Office of Management and Budget in June, and apparently has still not received an answer about how much this will cost and how the administration is planning to pay for it. She has since sent another letter, which actually Dan Diamond wrote about in Politico today, as a follow-up to say, it's been a month. I'd expect to see a response from you soon. So this is what's concerning, is that we don't have a lot of information, which I can imagine would be for two reasons. One, the administration knows and doesn't want to tell us, or, which I think is actually more likely, they actually themselves don't really have a handle on how much this is going to cost, since this is separating families at the border is a new policy. It was not something I think they had anticipated having to implement. And so my suspicion is that they're actually struggling to try to figure this out themselves. That said, in cases where you don't have funding in advance in anticipation of an unexpected public health crisis, there are a couple things that the department can do. You can, as the secretary, under law, transfer funding up to 1% of funding within the secretary's budget to support an emergency, and this has actually happened in the past. As they are awaiting additional funding, the secretary may shift funding around to try to respond to that emergency. Alternatively, the administration may submit a request to Congress for what we call emergency supplemental funding. This is funding, again, that is needed in response to an unexpected event, such as a hurricane, an outbreak like the Zika virus or Ebola virus. And that means that you don't have to rob Peter to pay Paul. You have resources available for responding to that emergency, rather than under the Secretary's transfer authority having to take money from other important public health programs, medical research, public health preparedness, workforce training, and use those monies to support the emergency response. So at this time, again, we don't really know how much is needed. And so until we know how much this is costing, how much they anticipate it will cost, it's hard to figure out how much then you need and how best to fund that. But for the Coalition for Health Funding, we feel very strongly that the administration should not be robbing Peter to pay Paul, that already Most public health programs at the Department of Health and Human Services are still underfunded, still recovering from years of austerity measures, including sequestration and other budget cuts, and in fact are operating at levels well below 2010 adjusted for inflation. These are the same programs that presumably in the future are going to be needed to help respond to this current public health crisis at the border, as these families and their children are sustaining this trauma and will have mental and physical health needs for the rest of their lives. It's for that reason that we really believe that this crisis at the border does rise to the level of a public health emergency, the same way of a hurricane, a flood, or other natural disaster, the Zika virus, the Ebola virus. The only difference is that this crisis is man-made. And while this crisis was not created by Congress or the taxpayers, it's the responsibility of Congress and the taxpayers to make this right for these families and to support that response. And that's why the Coalition for Health Funding, again, depending on how much funding is needed and assuming more funding is needed by the administration, in that event that we would need a emergency supplemental appropriations bill to help make things right for these families. So we have a lot of questions at the Coalition for Health Funding. I know lawmakers have a lot of questions themselves. Certainly the public does as well. So we're going to be watching this space very closely, and we're going to be doing everything to ensure that we can help the administration and get them the resources they need to support these families without, again, taking funding away from already underfunded public health and medical research programs. So please stay in touch with us, watch this space, and we'll be sure to let you know more as we know more. And thanks for tuning in for my first vlog.